I'm very happy to introduce Lisa Luan. She is a master student. She did her master in psychology at the University of Amsterdam and is now a PhD student at the Imperial College of London in the Center for Psychedelic Research, where she focuses on continuous IV infusion as a new method for DMT administration. And with her presentation on acute effects of extended DMT, I think she will present some results of effects of this, of her work. And warm welcome, Lisa.
Hello, everyone. Thank you so much for being here today. I'm going to make a slide switch, and we're going to go over to pharmacologically induced altered states of consciousness. I'm going to be presenting some of the work around continuous infusion of DMT that we've been conducting at Imperial College London. So just to give you a bit of a background, as you probably all know, DMT is a naturally occurring serotonergic psychedelic, and it is the main ingredient in ayahuasca, which is a South American brew that has been used for centuries for spiritual and religious purposes. DMT is known for inducing intense but transient altered states of consciousness, and the most characteristic subjective effects are complex and vivid visual imagery. You also have strong bodily sensations and a range of auditory, emotional, and cognitive effects as well. But maybe most characteristic actually are a sense of detachment from the outer world and a sort of immersion into a different dimension almost. And the report of encountering entities or sentient presences in this other world. The DMT experience is oftentimes seen as profound and can sometimes lead to lasting revisions of beliefs around the nature of reality and consciousness. So this makes DMT a valuable and unique tool for studying human consciousness. And indeed, there have been previous studies that have looked into the subjective effects as well as brain mechanisms of the DMT state. And also more recently, DMT has gained increased interest also for its potential therapeutic applications in treating mental health disorders such as depression. DMT is not orally active because MAO enzymes in the body break it down before it reaches the brain. However, it can be consumed in combination with an MAO inhibitor, as is done, for example, in ayahuasca, and this leads to effects that last for about 4 to 6 hours. On its own, DMT is mostly consumed by inhalation, for example, through vaping or smoking it. Alternatively, it could also be administered parenterally, for example, through an intravenous bolus injection. And these forms of administration lead to a very short action, which you can see here. So you can see that following a bolus injection, DMT's subjective effects begin almost immediately and peak within 2 to 3 minutes. And then they quickly subside thereafter, making the total duration of effects about 20 minutes. So this rapid onset of effects makes DMT quite unique among serotonergic psychedelics. And additionally, DMT also exhibits a couple of other characteristics, including there's no psychological tolerance to repeated doses. And these characteristics in combination make DMT suitable for IV continuous infusion. So this would allow a prolonged and safe immersion in the DMT state and would also be valuable to gain a better understanding of the DMT experience. And also it would open intriguing doors for potential clinical applications where it might be useful to have a substance that you could tailor in terms of intensity and length of effects to different populations and their specific needs. So exploring this potential for continuous administration is exactly what we've been working on in the past years. And this brings me to our current studies. The aims of this research project were to, one, to develop a protocol for the continuous IV infusion of DMT and to test the effectiveness of such an infusion in maintaining subjects at a steady level of immersion in a DMT experience over time. And this was assessed based on subjective intensity, anxiety, plasma DMT concentrations, as well as physiological response. And then the second aim was to investigate the effects of this continuous IV DMT infusion. So we were interested mostly in psychological effects, EEG effects, as well as physiological effects here. So in our first study, we aimed to develop a systematic protocol for the continuous IV infusion of DMT and to test the effectiveness of this protocol in healthy volunteers. And the goal here was to establish infusion parameters which would keep healthy volunteers at a DMT state in a stable fashion for a period of 30 minutes. So in order to do this, we used a pharmacokinetically informed approach with the help of our colleagues in Gothenburg, more specifically Emma Eckernes, who you can see over there. So she used DMT plasma concentration data from a previous study in which different doses of bolus IV DMT were given, and she used those to estimate pharmacokinetic parameters of DMT. And then use those to design dose regimens that would maintain plasma concentrations of DMT at different steady state levels over the period of infusion. So the idea was that steady state levels of plasma DMT concentrations would translate into a steady subjective experience so that participants should be able to stay in the DMT state for an extended period of time. So we chose 4 of these dose regimens that you can see in the table over there, ranging from threshold doses to high doses, and we tested them in healthy volunteers. We started with the lowest calculated dose regimen and worked our way upwards when, if the previous dose was tolerable and produced a peak intensity, subjective intensity of lower than 7.5 on a scale from 0 to 10. Our dosing regimens consisted of a bolus IV injection for 30 seconds, followed by a saline flush for 15 seconds. And then we started a constant rate infusion 1 minute after the beginning of the bolus injection and stopped the infusion 30 minutes after the beginning of the bolus injection. So this was a single-blind, placebo-controlled within subjects repeated measures design. We had 11 healthy experienced volunteers who received a placebo dose and up to 4 different doses of extended DMT. All dosing sessions were separated by at least 2 weeks. During dosing, we were measuring EEG activity acutely, and subjective effects were measured both acutely in real time using experience sampling, as well as retrospectively using different VAS scales and questionnaires. We also collected more plasma samples to model the pharmacokinetics of the infusion. And we completed in total 11 placebo doses and 30 DMT doses. So we had 6 doses with the lowest dose, we had 10 with the second dose, 9 with the third dose, and 5 with the 4th dose. So now onto some results. So this is the results on the effectiveness and tolerability of extended DMT infusions. So starting with anxiety. So we collected anxiety ratings during the infusion every 4 minutes. So for this, participants were asked to rate their anxiety on a scale from 0 to 10, with 0 being no anxiety and 10 being the most anxiety imaginable. So what you can see here is the average anxiety over time. So you see the different lines are different doses of DMT and placebo. So what you can see is that overall volunteers experienced minimal anxiety and mostly around minute 0 at the beginning of the infusion, which suggests that the anxiety may have been related to anticipation or like a initial discomfort, but overall that the infusions were well tolerated. And then of note here again that this was with a sample of experienced volunteers, so this might look different in a different population. Intensity ratings were also collected during the infusion. So for this, participants were asked every 2 minutes to rate the intensity of the drug effects, also on a scale from 0 to 10, with 0 being no effects and 10 being the most intense effects imaginable. So again, here you can see the different doses of DMT and placebo, and you can see that using our dosing regimen, participants were able to be maintained at relatively stable levels of drug effects over the period of infusion. And quite similar to bolus studies, the onset of subjective effects was fast, occurring within 2 minutes of the bolus being administered. And after an initial peak, the subjective effects remained relatively stable throughout the duration of the continuous infusion. We also did some linear mixed effects modeling on this, which showed a full dose effect relationship for all doses for minutes 1 all the way up until minute 42. And this was FDR corrected for multiple comparisons. However, there are 2 little things to note here. One is that the highest dose that we tested didn't quite elicit the effects that we were aiming for, so the peak effects of the highest dose were 7.2 at minute 2. And also importantly, there seems to be just a slight downward trend in the intensity over time. And I'm going to say more about that in a minute. But so let's move on to heart rate. We also monitored heart rate during the infusion. And what we found here was that there was an initial increase in heart rate by about 40 beats per minute on average. And again, there are 2 things here that are interesting. One is that there seems to be no difference between the different doses, so there's no dose-dependent effects here. And then secondly, the increase in heart rate normalized within about 15 minutes. So that's quite interesting because while the subjective intensity stays up, heart rate goes back down, again suggesting that continuous infusions are tolerable. And additionally, this also provides us with a very interesting window of time that we can use to analyze, for example, EEG data, because we have this block of time where subjective effects are really strong, but we don't have any of the heart rate confounds. Right, and then DMT plasma concentrations. So for this, we collected blood samples for 3 hours following the start of the bolus injection. And then results here show that there was one initial peak in the DMT plasma concentrations at minute 2, which is the first blood sampling time point just after the bolus injection. And then the second peak occurs just before the end of infusion, so at the last blood sampling time point before the end of the infusion. And then if you compare the intensity and the plasma concentrations, there seems to be something going on where intensity goes down slightly over time while plasma DMT concentrations continue to rise. So there seems to be something of a dissociation between intensity and plasma concentrations towards the end of the infusion, which maybe suggests a potential short-term psychological habituation, which we haven't quite seen before. And additionally, the second thing that I mentioned before is that the highest dose didn't quite elicit the effects that we're aiming for. So we took all of these results and went back to our pharmacokinetic model. Again, this is Emma's work. So what we did is we looked at the data we had. So we have here in one corner the IV bolus data from a previous study, and then we have our new infusion data. And you can see that there are slight differences between the studies. And this is not surprising considering the small sample sizes of each of these studies. So what we did is we combined all of this data to update our pharmacokinetic parameters, and we used those parameters to design an updated dose 5. So what we did for dose 5 is that we increased both the bolus dose as well as the rate of infusion over time. And then we went back and we administered this updated dose 5 to another 5 of our 11 participants. And you can see here the top line is the highest dose, the updated dose. And what you can see is that with the highest dose, we do actually reach a peak intensity of 8.5, and the higher infusion rate seems to work as well. So then what we did is once we established the effectiveness of dose 5, we administered it to a new sample, so another 16 healthy volunteers. And the goal here was to have to obtain a sample size of 20, which would be sufficiently powered for our EEG analysis of interest. So for the second study, we're really interested in collecting more data on this one high dose to really understand, really try and understand what is happening on a subjective level as well as on a brain level with continuous DMT. Right, so this was again a single-blind, placebo-controlled, fixed-order study. Volunteers in this study each received one placebo dose and one DMT dose, and study procedures were almost identical to the first study, with one main difference being in the experience sampling that we did acutely. So in study one, we used ratings of intensity and anxiety to kind of gauge the effectiveness and tolerability of our doses. And then in study two, we exchanged anxiety ratings with entity ratings to kind of focus more on the phenomenology of the DMT experience. And then we've just finished collecting data for that part of the study and are in the middle of analyzing all of the data we have. And I'm just going to show you some preliminary results on the subjective effects and EEG effects of both studies combined. So to look at the acute subjective effects, we used, amongst other scales, we used the Altered States of Consciousness scale and the MEQ. And I think what's most interesting here is that there's a significant dose-response relationship for all subscales of the ASC as well as the MEQ, except for audiovisual synesthesia on the 11D ASC scale, and except for vigilance reduction on the MEQ. Then we also asked participants to rate different dimensions of their experience over time, and this was done retrospectively using the intensity ratings that they gave acutely. So in total, we looked at 12 different dimensions, but I'm just going to show a section here. So you can see that there was strong visual imagery over the duration of the infusion. We didn't have that many auditory hallucinations in our study. Ego dissolution was also relatively low, and there were quite strong body sensations as well. And again, you can kind of see a dose-effect relationship, but because it's still a small sample size, I would take this with a grain of salt. And then now this is some very preliminary EEG analysis. So what I did here is, so basically this is a very small sample. This is just a subsample of all the data we have. I divided the different doses into 3 groups to look at different effects. So I combined the lowest dose and the second lowest dose in one group, then took the medium dose as the medium group, and then the highest doses, both dose 4 and dose 5 together. And then I also divided the time course into different blocks of time. So you have one baseline block, and then you have 3 acute dosing blocks, which are all 8 minutes. And then you have 2 post-dosing blocks that are also 8 minutes. So we're going to be looking at those. And here are some initial results. So this is the frequency spectrum of the EEG. And then each of the figures is 1 block of time. So each of them is 8 minutes. The first one is baseline. And then each line is a different dose. So DMT dose or placebo. So what you can see here is that acutely, in acute 1, so just after the start of the injection, you can see a very strong decrease in alpha for all doses. And this is sustained over the period of active infusion. And then I think the second very interesting thing we can see here is that theta seems to be going slightly down in the active infusion. And then there seems to be something that looks a bit like almost like a theta rebound that happens after the end of the active infusion. And then I also plotted this in a log scale to look a bit more closely at potentially gamma. So it does seem like in the active infusion time, there seems to be a bit of a gamma increase, especially in a high gamma. Again, this is very preliminary analysis, so we have to do some more checks and also increase the sample size. And then I plotted the whole thing as topo plots as well. So this is kind of the same thing. This is only the comparison now between the highest DMT dose and placebo, and this is baseline corrected data. So I took out the baseline and then did the comparison, and you can see the different frequency bands. And then again, you have the different blocks of time. So you have here, we don't have the baseline anymore. We have acute 1, 2, 3, and then post 1 and 2. And again, what you see here slightly is, so you see the very strong alpha decrease that happens acutely. There you can also see a little bit of the theta, maybe the rebound thing that seems to happen after the infusion. And you also see a bit of the increase in the gamma bands. And yeah, that's it. I would like to thank a really big team without who I wouldn't have been able to do any of this. And thank you all for being here today and listening as well.
Are there any questions?
Yeah, thanks for this beautiful data. I really enjoyed listening. So I'm wondering about qualitative differences. Did the participants report on the differences between normal smoke DMT versus the continuous infusion, and also maybe differences of DMT administered together with MAO inhibitors?
Yeah, it's a very interesting question. So we did actually do interviews with them shortly after the end of the dosing. We haven't really looked at that data yet, but I think from like what I could see on the dosing days actually. So I'm comparing normal DMT to the extended DMT. I'm not quite sure how different they really are. It does seem that like once the very strong physiological response that you have in the beginning goes away, people kind of settle into the experience a bit more. So I think that's quite novel that you have that time where like people can actually really experience what is in front of them without it kind of already slowly going away. But then in terms of kind of the quality of it, I don't know how different it really is. I think I do remember, I guess there is a bit like, I think as time passes, some people do have the feeling that it becomes more personal almost, so that like the chaos that you're confronted with kind of becomes somehow there's a more personal touch to it. But you also have people who just report something like, oh yeah, and then it was kind of like the same for 10 minutes. So yeah, I think it's a bit of a mixed bag.
Hi, thank you for this excellent work. I think there was a slide for another trial that there was no bolus, but I was wondering, was there a trial without a bolus?
Yes, there was a previous trial with a bolus, just with a bolus.
No, without a. So I was wondering
right,
actually.
Yeah, there was a. Yeah.
I was wondering actually, if we want to get the physiological immediate response of the bolus out of the equation, wouldn't it be an option to have only the continuous infusion with a higher dose in total? Yeah. What would you think about that? Would that be have any benefit?
So there is actually, you're right, there is actually a different team in Basel who's tried exactly that. So they had both conditions with a bolus and a continuous infusion, and also without the bolus. And then I think the main difference is that it takes a longer time to reach sort of a steady state. So it takes about half an hour to get into that steady state. And once they're in there, it's more stable. And I think they're both valuable. It kind of depends on what you're trying to achieve. And again, like I think this is the beauty of this work, is that, you know, you're really trying to refine this technology that you're using to administer DMT, and in different ways, and it really depends on what is the purpose and maybe like what is the population that you're using it for. So for example, I think that with a fast bolus injection, it can be quite overwhelming, the anxiety at first. So this is more suitable for experienced people, and then, you know, but yeah, I think there's value in all of them. Yeah.
now we're overlapping. We both got a microphone. He was signing over. I'll keep it very brief, all right? Just a quick question. Did some of the people maybe mention if they sort of got better at navigating that space as they stayed in there, some sort of agency creeping in?
Yeah, very interesting question. So for the first study we did, actually, because it was a repeated measures design, people did come back for up to 4 different DMT sessions. So I do think that there was a bit of a learning almost to navigate that space. So some people also had the intention coming in because they knew they were going to be coming back for different doses. The intention of some of them were to try and learn to navigate that space better. So I think there's definitely something around that as well, that you kind of become better at engaging with the space over time almost. And I think also, similarly, that might also happen actually during one single infusion, where over time you kind of like, you gain, as you said, you gain a bit of agency back, and you kind of try out, for example, engaging with it more proactively. Yeah.
Hi, Lisa. Thank you for your talk. I had a very different question about the PK of DMT. So in your slide, you said that there was a Cmax at 2 minutes and also a Cmax at 29 minutes. Do you have an explanation for the 29 minutes? Because you keep the infusion the same level, right? So you wouldn't expect it to keep increasing over time.
Yeah, that's a very good question. I think if you give one concentrated infusion, this is actually quite this is what you expect to see. So basically, because we only gave an infusion of 30 minutes, basically you kind of only reach a really stable steady state at that 30-minute mark of time. So it's kind of expected that the PK would actually increase all the way up until 30 minutes, and then if you continue, maybe it would stabilize a bit more. But again, I'm not really the expert on the PK. So I think Emma would be able to tell you much more about that. Yeah, I definitely recommend her papers as well.
Hey, I'm wondering what you think the effect of like asking people every 2 minutes, like in terms of, because the ego dissolution was really low. Do you think, like, have you considered having sessions where you don't interrupt and then just ask them like immediately afterwards, or to compare?
Yeah, definitely. I definitely think that the ego dissolution scores being that low might be related to the experience sampling that we do over time. In our previous study with only bolus DMT, we had one condition with intensity ratings and one without intensity ratings, and definitely you do see a difference between those two conditions. But then I think for our study, because this is kind of like still so new and we are really trying to understand the PK and the intensity, it was really important for us to have that data of what is actually happening. And then I think definitely in future studies it would be really, really interesting to compare that maybe with a study where they don't have their experience interrupted as much.